What doctors call an overactive bladder or an enlarged prostate is actually the code name for a bigger and more hidden disaster. This is your body's encrypted message telling you that your nervous system, the commander-in-chief of your entire body, is on the verge of a complete collapse. That mental map you have in your head of all the bathrooms in the city, planning your route based on it. That fear that grips you with just a sneeze or a cough. That moment during an important meeting when all your focus, instead of being on the CEO's words, is on the pressure in your lower abdomen. These are not the symptoms of a simple illness. These are the muffled screams of a body that has lost control, with your brain rebelling against itself. Today, we're going to decode this together, suppress this rebellion, and reclaim command once and for all. The main problem isn't a weak muscle. The main problem is a dangerous connection in the wiring between your brain and your bladder. The urinary control center in the brain, located in an area called the pons, gets confused due to chronic stress, anxiety, and bad habits. It's like a panicked, inexperienced driver who, in a moment of panic, slams both the gas pedal, the parasympathetic system for emptying, and the brake pedal, the sympathetic system for holding in all the way. The result of this internal chaos is a neurogenic and psychological bladder that, on one hand, creates an intense urgency that drives you to the bathroom, and on the other hand, when it comes time to go, it doesn't have the strength to empty itself completely, so that damned feeling of never being fully relieved is always with you. So how can we completely rewrite this faulty operating system from the ground up? First of all, there's bladder retraining. You have to make this little dictator understand who's really in charge. Instead of rushing to the bathroom at the first warning sign, try to hold it for a few minutes. Tell your brain to wait, it's not time yet. Make a bladder diary for yourself and for 1 week, write down exactly when and how much you drink, and when you go to the bathroom and how you feel each time. Then, set up a regular schedule for bathroom visits like every 2 hours. Whether you feel the urge or not, gradually increase this interval to 2.5 hours, 3 hours, and even longer until you regain control. Now, let's move on to the special forces, the pelvic floor muscles, also known as Kegels. To find these unsung heroes, imagine you're trying to stop yourself from passing gas. You need to contract exactly those muscles and then relax them. Every day, do several sets of 10 to 15 5-second contractions each time. But the golden rule is, never, ever, ever do this while urinating. Doing that is like unplugging your computer in the middle of a Windows update. You'll mess up the entire signaling system between your brain and bladder, and things will get worse. But that's not all I have to say. I'm also going to share some techniques, some medications, and some traditional remedies. But gentlemen, make it a rule to sit down while urinating and lean forward a bit. In many countries, men urinate standing up, which is a big mistake and causes the bladder not to empty completely. Ladies, make sure to place a small footstool under your feet as well. If you're using a Western-style toilet, do this so that your knees are higher than your hips. This angle puts the urinary tract in the most optimal position. Before you start, take a few deep abdominal breaths to send a signal of relaxation to your brain. After you think you're done, you should use the double voiding technique. Stand up from your seat, wait for 30 seconds. Then lean forward a bit again and try to empty out the remaining urine. You'll be surprised at how much urine is still left. An additional technique is tapping. Gently tap the perineal area with your fingertips, a spot between the anus and the scrotum in men, or between the anus and the vagina in women, to help release the last drops. Before I continue, I'd like to take a moment as a friend to ask you to support me in this video in any way you can, and find easiest like, subscribe, leave a comment, or share this video with others. And if you're outside the country, you have the option to send a super thanks or join as a member. The link is below the video next to the like and subscribe buttons. Doing this helps motivate me to keep going. It lets me know I'm on the right track, and if you don't want to support, I completely understand. In any case, thank you all for your support. Let's get back to the rest of the discussion. Let's dive into the arsenal of traditional medicine and smart nutrition things that few people have told you about. First, you need to know your enemies and eliminate them from your life. Caffeine, coffee, strong tea, soda, alcohol, carbonated drinks, chocolate, very spicy foods, acidic foods like tomatoes and tomato paste, and artificial sweeteners, All of these are like pouring gasoline on the fire of your bladder. Also, get rid of this common misconception. Drinking too little water is a disaster because it makes your urine concentrated and acidic, which only makes your bladder more irritable. Drink enough water throughout the day, but stop drinking liquids 2 to 3 hours before bedtime. Our main hero here is raw, unsalted pumpkin seeds. Eat a handful of them each day, as they're packed with beneficial compounds for the prostate and bladder. After that, move on to the magical herbal infusions. Corn silk and horsetail are rich in silica, which acts like cement to repair and strengthen the tissue of the bladder wall and urinary tract. Chaste tree distillate and nettle tea are also excellent and serve as powerful cleansers for the urinary system. From the perspective of traditional medicine, the root cause of many of these problems is coldness in the pelvic area. So every night before bed, gently massage the lower abdomen and bladder area with warming oils like black seed oil, olive oil, or ginger oil, and keep it warm with a woolen scarf. Warm cupping therapy on the lower back and bladder area should be performed by a specialist. This both restores blood flow to the area and has an incredible effect. Every morning on an empty stomach, also eat a spoonful of lightly crushed black seed with honey. From the perspective of acupressure, there are also two solutions. I'll teach you 2 points, make sure to try them. One is 4 fingers below your navel, the CV6 point, and the other is 4 fingers above your inner ankle, behind the shin bone, the SP6 point. Press and massage each of these points several times a day, each time for 1 or 2 minutes. Of course, keep in mind that sometimes the problem is more serious than this, and you need to turn to modern medical science. A urologist might check your urine flow pattern with a bladder percussion test or uroflowmetry. They might prescribe medications like tamsulosin, which works quickly like a drain opener but can cause dizziness, or drugs like finasteride, which gradually shrink the prostate but may affect your hormones. For overactive bladder, there are other medications like oxybutynin, but also listen to these final red flag warnings, which are no joke. If you see blood in your urine, have a fever and chills, feel severe and unbearable pain in your side or lower abdomen, or worst of all, your urine is completely blocked and you can't pass even a drop. This is not the time for playing doctor or trying traditional remedies. This means it's an emergency situation. Get yourself to the nearest hospital immediately and make sure you're under the care of a specialist. This knowledge is a complete battle plan to take back control of your life. Send this to anyone whose health matters to you, because this problem is a silent epidemic that is tormenting millions of people in silence and shame. Stay strong and powerful. Until the next video, take care.